Hi, my name is Nate. I'm a Bellarmine nursing student, and I'm going to be doing med prep today. So the first thing I'm going to do is I'm going to verify my patient's MAR with his medicine drawer. I have George Jackson, I have 12/24/1948, and I have medical record number MR0841. Perfect. So the first thing I'm going to do is I'm going to get out his PO medicines. So he has furosemide. He's got a 40 milligram tablet. It is due daily at 8 a.m. by mouth. All right. I'm going to make sure that it is not expired. Make sure the package is intact. Okay. And then he also has pantoprazole sodium, 40 milligrams. It is one tablet due by mouth daily at 8 a.m. I'm going to make sure it's not expired and the package is intact.
His blood glucose was measured at 323 this morning, so if I look on here,
And next, I'm going to draw up his hepatitis B surface antigen vaccine. I see that I need 1 milliliter, and it's going intramuscularly, and it's due once today. So I'm going to grab my hepatitis B surface antigen vaccine, 0.02 milligrams per milliliter, and I need 1 milliliter of this. I'm going to go ahead and clean off the top of the bottle for 15 seconds. Alright. And based on Mr. Jackson's weight, the dose, and the type of medication, I've selected a 1-inch 23 gauge needle.
what's this, the patient's blood glucose level? It's 323.
So I'm going to go ahead and draw up 1 milliliter of air.
8 units.
And then I'm ready to get the syringe filled. I'm going to push the air into the vial. I'm going to draw out 1 milliliter.
And the reason we do that
Alright, 1 milliliter.
patient, so we have to have another check and another nurse to make sure that it's the correct.
I'm going to go ahead and make a label for this so I don't mix it up.
So I'm going to go ahead.
So I have George Jackson.
Insulin because it's on the orange cap. I'm going to go ahead and label it anyway, just
I have
because
hepatitis
in case there's other insulins laying around.
B vaccine,
That will just distinguish it from the other ones.
0.02 milligrams per milliliter.
Up here,
I have 1 milliliter of this.
the drug is
It is going intramuscular
the dose, which
at
is 1 milliliter.
0800
It's
hours.
intramuscular. That's the route, and then 0700 once, and that checks out.
Alright, so I'm done with that one.
To go
I'm
ahead,
going to set this next to my PO
set
meds.
this over here.
And then lastly, I'm going to do his insulin. So Mr. Jackson is getting
So
regular insulin, 100 units per milliliter, and it's going subcutaneous. And based on his sliding glucose scale, which was 323 this morning, he's going to get 8 units. Okay, so I'm going to get my insulin needle out, and I'm going to clean the top off this insulin bottle as well
here it is.
for 15 seconds.
Wipe off the top while I prepare my syringe.
Alright, leave that right there. So he's getting 8 units based on his sliding scale.
So, based on his weight of, I believe it's
So I'm
102
going to pull it back
kilograms.
to 8 units.
I'm going to let that dry. Based on his weight of 102 kilograms, I'm going to be administering
So now I'm ready
his
to
1 milliliter
draw up the
hepatitis
insulin.
surface antigen vaccine. And
I'm going to push the air in.
that is 23 gauge.
And I'm going to draw back
inch.
8
So
units.
I'm going to go ahead and open that. Being careful.
I'm going to come a little bit past and then flick out the bubbles and come back to 8.
Will be connecting to the syringe. And I'm going to go ahead and open, since it's 1 milliliter, I'm going to have a 3 milliliter syringe. I'm going to go ahead and open that. Also being careful not to touch the opposite end to where the plunger is.
Alright, and then I'm gonna need another RN to verify my insulin.
Okay, great. So I'm just going to look at
It's away.
vital signs. Look at
And since it's 1 milliliter, I'm going to go ahead
Okay, so the last bedside glucose reading was 323.
And we'll now dry the top here. Let the air out inside. And draw back.
So I think it's 8 units. So I'm looking up here. Yes, it's 8 units.
Thank you. So now that I have done all that, I'm going to go ahead and do my second check. So I have 1 milliliter of hepatitis B surface antigen vaccine, pre-filled syringe. It's 1 milliliter. It's due intramuscularly and at 8 a.m. Make sure I have 1 milliliter. I'm going to make sure I have my furosemide 40 milligrams tablet due once today at 8 a.m. It's not expired and the package is intact. And then I have my regular insulin. I have 8 units. It's due at 8 a.m. And I have 8 units based on his blood glucose reading.
8 units. Subcutaneous. 0700.
Because it has an orange cap, it's insulin, and I do not need to mark it with a label.
That checks out with everything over here.
And then lastly, I have my pantoprazole sodium, 40 milligrams. It's due at 8 a.m. 1 tablet, not expired, and the package is intact. At this point, I would go to the patient's room and do my third check.
Sodium. That checks out here.